Hi everyone, my name is Junya Shimamoto from Rollins School of Public Health in Emory University in Georgia. While I work as a general physician in a countryside in Japan, I'm learning public health as an executive master of public health student through online and offline hybrid class. I'm very pleased to have this opportunity to make this video as applied public health experience, which is one of the requirements of graduation of this MPH program. Let's get started. The title of my presentation is Evaluation of the Suicide Prevention Program at Ipponmatsu Elementary School. The principal of this school, Mr. Hamami, kindly accepted my offer to be the site supervisor. Allow me to use this opportunity to offer my thanks. And I don't have any conflict of interest of my presentation. Here, you can see the contents of my presentation. First, I'll give you a brief introduction. Next, I'll share with you the objectives. And third, I'm going to talk about the competencies that I can achieve through this public health activity. Next, I'll explain the project, then I'll review the outcomes. Finally, I'll finish with what I learned from this project. Let's begin. First, introduction. Suicide death has increased by 6.7% in the span of 26 years. As a result, 817,000 people has died due to suicide in the world. While the total suicide number has been reducing nationally, the rate of cases among children has been increasing. According to the Japanese Education Ministry, bullying is one of the causes of child cases. Therefore, the Japanese Ministry of Education, Culture, Sports, Science and Technology, called MEXT, has decided to choose an elementary school as a model for suicide prevention program. This time, I was asked to be an evaluator this first suicide prevention class, so I used the framework for program evaluation made by CDC. Let's move on to the objectives. Our aim is to conduct the pre- and post-evaluation of the cognitive skills associated with the sign of suicide among 6th grade students. You may see that this is important so that we may assess the situation of these children and make some precautionary measures. Moreover, we'll share the pertinent prevention program evaluation results with communities such as teachers in this town, public health nurses, parents of the student, and all other staffs. This would serve an eye-opener for us. We should also evaluate the result of this experimental or trial suicide prevention program for elementary school students. And next, let's just review the competencies. Since we're MPH students, we have to choose a competency that we can learn from this public health activity. This time, I select quantitative and qualitative data collection methods appropriate for a given public health context, and I interpret the result of data analysis for public health research. And I propose the strategies to identify stakeholders and build coalition and partnerships for influencing public health outcomes. And I assess the effect of this activity, and I plan public health intervention and programs in the future. Next, let's talk about the project. In order to an environmental setup in the school, the teacher has conducted a questionnaire to observe mental condition of 6th grade students. This is significant to ensure a smooth facilitation of the program. Then the teacher and the public health nurse, as well as I, had a meeting with stakeholders So, in order to share information about the social needs that I have mentioned in the background section and the purpose of this project. And also, the teacher provided the necessary information to each parent about this program before having the class for these students. At the same time, the public health nurse has visited all stakeholders and has asked for collaboration for suicide prevention. In the class, teachers as well as public health nurse had a lecture and discussion to encourage students how to recognize their mental problems when they encounter such a painful situation. In addition, teachers promote an aspirational attitude towards others with the aim of maintaining a good mental health throughout their lives. The public health nurse emphasized that it is essential for students to communicate with others about the mental health issue. And after the class, the teacher has conducted the same questionnaire to confirm the student's thought of committing suicide. Moreover, an analysis for both quantitative and qualitative style answers were provided. Finally, I evaluated the whole process with CDC evaluation framework, which include six steps such as engage stakeholders, describe the program, focus the evaluation design, and gather credible evidence, justify the conclusion, and ensure use and share lesson learned. Here you can see the picture. The upper left side. Before the class, we discussed the background of this project and whether the PTA staffs and teachers in this town. And you can see the picture in the class. The teacher facilitates the student to discuss how to deal with the painful or challenging with friends and teachers and others. Let's review outcomes. So here you can see that the outcomes, there is a significant increase of percentage of awareness of how to show suicidal tendency among children. While children lack the resourcefulness of dealing with the things that they ought to do when they feel suicidal, there is an increase of awareness and responsibility after taking the class. In the second outcomes, reports of this program were sent citing why these had to be conducted, and the result of the questionnaire filled by students were also included. And with regard to such outcomes, the evaluation results show that several things needed to be improved, such as expand this project and create a logic model, prepare written evaluation protocol. As for the final outcome, our recommendation is to expand the finding by using a newspaper or social media such as Facebook, homepage of this town, because this is the only way for the community to be informed on what this program is all about. Aside from these outcomes, it is a good opportunity for parents to recognize that when their children have emotional pain, they need to be informed on how to deal with the issue. Lastly, I share what I have learned from this project. So we found a difference regarding how to take action after suicide prevention class among elementary school students. With the CDC evaluation framework, we found out about the improvement of this first program. We hope it will be improved in this suicide program. And throughout this program, children and their parents could communicate with each other, which is a pivotal role to prevent suicide. That's all my presentation. Thank you for listening.